Hi, everybody. Welcome to Life Stories Podcast, People Helping People. I'm Shara Goswick, your host. My guest today is Dr. Nigel Brayer. Dr. Nigel is a doctor of chiropractic, but he calls himself a natural bladder doctor. There was a situation that arose in his life that set him on a mission to helping women heal their bladder issues without surgery. He has an incredible program that has wonderful success, and I think this is a very important issue for women. We don't talk about it often, but I think it's something a lot of people deal with. I know you're going to enjoy this, and if you know someone that would benefit from Dr. Nigel's program, from the information that he offers, please send them this video. I think everyone needs to listen. Thanks for being here. Well, thank you so much for being a guest. My husband is a PT, and a lot of the people that I've talked to, not a lot, there have been several people that I've talked to who have shared information that has been helpful to him as he can help his patients, and this is one of them. So he was very excited that I was going to talk to you today. So you are a natural bladder doctor. What exactly is that?
So, a couple things. It's not a, I guess, formal designation. So, I started my practice almost 28 years ago in chiropractic. And then I melded into functional medicine, which, of course, is nutrition and biochemistry and GI and liver health. And then also, I'm an acupuncturist. So, I involved kind of the ancient Chinese, I'll call it energy pathway systems. So natural bladder doctor would mostly mean that I just address the common bladder issues, and I developed a program, which I'm sure we'll talk about, to address bladder issues naturally.
Yeah.
So, and I'm sure we'll kind of get to this, but there's not a lot of great options for urinary incontinence in men, women, anybody. But of course, due to anatomy and physiology and hormones and everything else, it's a lot more common in women.
Yeah.
And then like my personal story, this wasn't like a dying desire, like, wow, I really want to change the world by helping them, be dry, right? So
Right.
it was mostly out of self-preservation, to be honest. So my story is my wife Brandy, we've been married about 15 years. My youngest son Jude, who's 8, after birth of Jude, she really lost most of her ability to control her bladder.
Mhm.
And now I didn't find this is all hindsight, so I'll give you the quick snip
Right.
version. The snip version is she didn't tell me this for almost a year,
Wow.
but she started avoiding. And I've come to learn over the years is that avoidance is a pretty typical. So she started wearing pads, and then she started avoiding trips, and then she avoided
Yeah.
circumstances. And initially, as a spouse, you're like, okay, well, maybe it's postpartum, maybe it's this, and we go through the whole myriad. And after much kind of probing on my part, she kind of broke down in tears and sobbing and embarrassment of she's like, I just can't control my bladder. At
Yeah.
that time, she was in her early 40s, and clearly that's not healthy or normal. So,
Right.
of course, I'm in the healthcare field. So I'm like, all right, well, I'm a male, so I like to solve problems. So let's solve this problem and move on, right? And
Yeah.
so I said, well, let's go to your OBGYN and see if there's something wrong. So, of course, we went there and we did that, and they did an evaluation, and they said, hey, everything's physically fine, no problem.
Right.
Um, so they said, hey, let's go to physical therapy, have some pelvic floor therapy done. This is our kind of standard of care. And we did 8 weeks, or not we, she did 8 weeks, and she had almost no improvement, about 20% or
Wow.
so. And so we went back and had a further discussion, and the doctor said, "Well, hey, there's not great options, but we can try some beta blockers. And for those out there, that affects your nervous system and your blood vessels and
Oh,
most of all the linings of your tissues. And we can do beta blockers, or we can do Botox as an option, where they inject that in and around the urethra where the urine comes out to relax some of the possible trauma, even though she didn't really have trauma in that area, but that's something they use. Or they can do a urethral sling, which is a surgery where you lift up the urethra. So for your listeners, the bladder's like a balloon. And then from that balloon, like where you blow your balloon up, there's a straw coming out that would be called the urethra. And there's a bunch of little valves on there called sphincters. And so what they do is they try to lift that to take off possible pressure as, kind of an attempt to try to help. And of course, I'm in the natural health field, and my wife's very naturally minded herself. And she's like, none of these seem like great options.
Right.
So the doctor said, well, we can try them, but I don't have any other options for you. So again, 42 years old, lost at least 60% of her ability to hold her bladder for no apparent reason. So that kind of set me on this little path of like, I have to figure this out
Sure.
because, and this is where the self-preservation comes in because we're, an athletic, active family and we like to travel and do all sorts of stuff. And I'm like, well, my partner and friend is unable. And I'm
Yeah.
like, I'm not cool with that. So
Right.
I really just kind of dug deep into, all doctors are pretty much educated the same. It's really just what direction they turn into after the third or fourth year. And so I thought, well, I'm going to start looking at urinary function. And again, I went through, kidney function,
Yeah.
ureter, that's the tubes from the kidney to the bladder, bladder function, and the muscles and the nerves, and then the urethra. But I guess what really kind of had a big aha moment is I was looking in the neurology of what's called the sphincter, which is the valve, and
Hmm.
neurology is the nerves and the supply from the brain. And what I discovered, and it's not a new discovery, it's just it was a discovery for me, is the sphincter of the bladder and the bladder itself is only 30% consciously controlled.
Huh.
So think about this for a minute. So 30% is consciously controlled. So if I lift my arm and contract my bicep muscle in my arm, I have 100% conscious control of that muscle.
Right.
So now imagine that muscle's 30% consciously controlled. That means I can control it. So that begs the question, what's the other 70?
Yeah.
And so as I was reading this article, I'm like 70% of the urinary bladder and the urethra is unconsciously controlled, which means it's autonomically controlled. And what
Yeah.
that means is the same thing that's beating your heart is controlling whether your bladder works or not.
Wow.
So that begs the next question is, okay, well, what is going to influence your autonomic nervous system? So I dug a little deeper, and again, is the autonomic nervous system is broken up into two different systems. You've got what's called
Yeah.
the sympathetics. The sympathetic is the fight, flight, strive, protect part of our nervous system to keep us alive under, challenging circumstances. And then the parasympathetic is the heal, relaxing, restoring component.
Right.
Okay. So I thought to myself, well, if we want to help the bladder, we can't just do Kegels.
Right.
Kegels for people out there is imagine you're going to the bathroom and then you stop going to the bathroom. That action is controlling those valves, and that's how most exercise
Yeah.
is kind of addressed is by strengthening that Kegel type response. And so I started looking into, well, how can I influence the autonomic nervous system to take it out of a sympathetic dominance? That's the fight, flight, strive, push, which will end up usually causing what's called urge incontinence,
Yeah.
where people get halfway to the bathroom and then they start to leak because they start thinking about it, right?
Right.
So that's more of a neurologic. And then there's stress incontinence, and those who can break those up a little more in a minute. But so I started looking into ways with acupuncture and biofeedback and vagal nerve activities of influencing the nervous system in a consistent way with the whole goal of getting my wife, back
Yeah.
and more importantly, improving her bladder function. So I started really just I'll call it trial and error with her. So I'd read some things and I would implement and read and implement. And then over the next probably 5 or 6 months, we really dialed it in to be extremely effective. So again, I've been in practice a very long time, or quite a few years. So I started digging through my patient files of people who are coming in for other reasons, and in our office, like most offices, we do what's called a review of systems. So
Hmm.
what we do is ask about things that may not be pertinent to their current condition. And I went to the urogenital stuff, and I noticed that huge numbers of the patient base that I treated checked off urinary incontinence on that form.
Wow. Yeah.
So I wrote their names down, and as they came in for other issues, I'd ask them, I'd say, hey, you talked about this when we first met. How's your bladder issues? And invariably, they still had them.
Yeah.
So I asked around 200 patients over a period of about a year and a half to 2 years. When they came in, I said, hey, would you be willing to try this protocol that I developed for my wife? And of course, they're like, yeah, absolutely. So of those people, I started integrating this protocol, and every one of them improved dramatically,
Wow.
most over 90%. So we use a very specific kind of quantitative measure of our progress. And over that period, we had over a 90% success rate without any drugs, without
Wow.
any surgeries. So so then I looked into some other things, and again, this is a process, but as I was learning and getting more momentum, I started questioning. I'm like, well, why did it take so long for my wife to bring this up to me?
Yeah.
We're intimate partners. We've been married together a long time. And I thought to myself, she felt embarrassed talking to her closest friend. How
Yeah.
do others feel who have no
Sure.
connection? And what I
Sure.
realized is the majority of people talk to no one.
Yeah.
They just go along, and I don't encourage people to watch TV because it's not healthy for them. But if you were to watch TV,
Yeah.
you would notice that there's huge amounts of pad commercials and adult diaper
Yes.
commercials.
Yeah.
So that usually means, just like medication commercials, that people are in need of some solution.
Yeah.
So the one of the biggest problems that I kind of sought to resolve is, how do I help people who don't feel comfortable asking for help?
Yeah.
And that's kind of where I'm sitting now, is giving information. And I took my program, instead of coming into my office and doing these protocols, which would take a period of time and cost so much money, is
Sure.
how do I make it really accessible to them, so they don't have to have a conversation that
Yeah.
they don't want to have, that they can do what was successful at home without, having to talk to someone. And that's
Right.
kind of where we're at now. So I took all of the program, kind of conglomerated into
Hmm.
really simple steps, tracking and things that they can do over 30 to 60 days. And
Yeah.
what we found is the success rate was equally as effective as though they came into my office and I
Oh,
was doing the
wow.
procedures. So that's
That's
kind of where we're at
amazing.
now. Yeah, isn't that
Yeah.
exciting? It's
It
kind of
is
fun.
exciting. And I will say, and I don't know how, I mean, maybe it is a common fear for women, but I will say this is a legitimate fear of mine because um, there's a place that I shop and there's a sweet little lady, bless her heart. You can tell that's a problem. And, for one thing, she's probably on a limited budget and it's
Sure.
expensive to buy, pads and diapers and all the things that they need. But also, it's very obvious that she has that problem. And that is a legitimate fear that I have. I don't want to get to that point. How do you know when it's just something that happens occasionally, or should it not happen at all? Um,
And that's an awesome question, Shara. So I'll just give you a kind of a case study. This happened today, actually, because I still treat this condition in my office. And this woman came in, she's in her middle 60s, and she said, "Hey, I'm here as the guinea pig." I said, "Well, what's that?" She goes, "My girlfriend sent me here because she has almost no continence capacity at all." She goes,
oh,
"I'm not,
wow.
I'm not too bad." She goes, "If I'm at home," she goes, "I have a real problem. But when I go to exercise class, or she likes to go to the casino, when I go to the casino, I'm fine." She
Huh.
goes, "So I'm here because my friend is too fearful,
Yeah.
but it's not too bad. I just leak at home, no big deal." So I asked her, I said, "Well, that's, understandable, but things in life have to progress, right?
Yeah.
We're getting older. So our tissues aren't as elastic as they are. So, and then we also have hormones. So remember, as a lady ages, and men too, but lady in particular, is progesterone changes. That's
Right.
as the ovaries no longer function as well. Progesterone is like the testosterone for women. It gives
Yeah.
them energy, it gives them strength, it gives them metabolic activity, where estrogen is more the holder honor. It
Yeah.
packs things, it prepares, right? So all the hormones drop. So it doesn't just affect the uterus, it affects all tissue, bladder, blood vessel, muscle, everything
Yeah.
else. So our anatomy and physiology is designed to work. We as people, and I'm no different, is we kind of justify. It's like, oh, it's not so bad. Oh, it's just a little leakage here,
Yeah.
but it has to worsen. So,
Yeah.
long story short, is the fact that it doesn't function means something's interfering with its efficiency.
Okay.
And so, what I encourage people to kind of ponder is, there's three things that affect all of us.
Hmm.
There's physical stressors, that can
Hmm.
be the nervous system, that can be the spine, that can be muscle integrity. There's nutritional, chemical, hormonal stressors.
Mm-hmm.
And then there's mental and emotional stressors.
Yeah.
So those three things are always kind of in this fine little juggle balance. And
Yeah.
so, and when those imbalances get bigger and bigger and bigger and bigger, then the body can't restore its proper function. So
Yeah.
then things start happening on a bigger basis, right?
I gotcha.
So I would make the analogy, it's like, when's the best time to look after your teeth? When you have a cavity or
Right.
well before? And
Yeah.
it's no different, right?
Right.
So
Yeah.
so the goal is that's designed to function unless something's interfering with that.
Right. I understand. And I read as I was reading your things online, you talked about stress, affecting this part of our body. I didn't realize that, other stresses could be an issue with everybody's stress. You know what I mean? Everybody's got stress of some form, but I didn't realize it could affect you.
Well, think of it this way, Shara, is our body, first of all, us as humans, our memories are short, right?
Yeah.
Which has pros and cons. But if we went back to where were we, you and I, let's say 30 years ago,
Mm-hmm.
your body, your mind, all these things would be so different, but we can only
Oh,
remember
yeah.
back so long. But what's interesting is our subconscious mind remembers.
Mm-hmm.
So it's almost like a big, I'll use a cloud storage because we can relate to that, but
Yeah.
is it stores everything that's ever happened, all of our joys, our sorrows, our
Right.
traumas. And what I call this is our sympathetic tone. So the same reason heart disease is the number one cause of death in most first world nations, remember, that's a sympathetic disease.
Yeah.
For those out there, sympathetic means the body's in fight or flight all the time.
Right.
Therefore, the heart rate is high, the blood vessels constrict. That's why beta blockers, which is what they prescribe my wife, what do beta blockers do is they relax the blood vessels in the heart by using a chemical to try to chill it out. Now, it doesn't solve any problems, but it gives a
Right.
short-term change, right? Because they know also that the heart disease isn't a heart or a fat problem.
Right.
It's a sympathetic problem, which means it's a stress problem.
Yeah.
So I think of it this way is if the pressure's up to 10 today and then tomorrow it's up to 11 and then 12 and over 20 years it goes up 100 points, whatever number we're talking,
Right.
is you don't know the difference because yesterday it was just a tiny bit less
Yeah.
than today. But over
Yeah.
40 years or 20 years, that's a lot. And our body responds to that and our bladder does too. So,
Yeah. It does. This is off topic a little bit, but I got the book, The Body Keeps the Score. Have you read? I don't know
uh-huh,
if you've heard
I
of that.
have. Yeah.
I've only read the first chapter, but I've heard so many great things about it. And I believe that. I've seen it in my own life, the way my body has been affected by major things that have happened. So I know you're right. I know it's absolutely true.
So I'll pivot a tiny bit. So The Body Keeps Score, a great book, just kind of is a synopsis of all of these things affect our general response,
Right.
right? And so that's going to affect the bladder, that's going to affect the mind, that's going to affect the heart. So
Mhm.
people say, oh, let's just get rid of stress. Well,
Yeah.
stress is a perception-based thing,
Yeah.
remember? And so remember, something joyful to you could be stressful to me. The event's neutral. Our
Sure.
mental attachment or whatever to that is what makes it stressful.
Yeah.
So I guess the key to, and I'll just talk about the bladder specifically. So the key to what I do is help reset that pathway that's become offset.
Yeah.
Okay. How do you then affect I call it the mainframe between the ears? And so that's where the next step goes is we have to start changing how we respond to life differently. Now, this
Right.
is a process, of course,
Sure.
but by changing our responses to life, our judgments, our expectations, those type of
Yeah.
things that we react to mentally over time, then our whole health starts to change
Yeah.
and chronic disease, which we're all trying to avoid chronic disease. And the way to avoid chronic disease is by managing, the stressors, not
Right.
managing meaning manipulate the situation better.
Right.
Managing means by letting go
Yeah.
and trusting and kind of those more spiritually based
Sure.
things that we've all been taught but are harder to practice. Yeah.
Yeah. So let's talk about the ironclad bladder system that you have developed. I know you mentioned it earlier, but how does it work? So for somebody, if you're not seeing everybody in your office for this, you're able to help them. How do they access this program and what exactly is it?
Sure. So the easy access, they just go to my website. It's drnigelbrayer.com. And there they can download the the entire protocol and or they can order the hard copy. Okay.
Hmm.
So what it is essentially this is we first start with getting information and data. Remember I talked about the triangle and I said, hey, there's physical,
Right.
neurological, like physical and anatomical issues that have to be addressed.
Sure.
There's nutritional, chemical, hormonal issues that have to be observed and addressed. And then there's mental and emotional facets. Okay.
Yeah.
So the program is really, it's not a deep dive in all of those because those are lifetime works for all of us, right?
Oh, yeah.
But in relationship to the bladder is we start with a quantitative analysis that they do at home. It's just a questionnaire which attaches a number and it helps us isolate, is it urge incontinence or is it stress
Right.
incontinence? And usually it's somewhat both. Okay. And so once we assess, then that would determine how many times a day a person would do the protocol. And the protocol
Yeah.
is the one I developed to help my wife and others in my office. Then in there, we have a journal. And in that journal, we have people, and I call it the food mood journal. So we start tracking everything we eat and drink. Okay.
Yeah.
We start tracking how many episodes of leakage we have each day. Okay. We track how many times a day we did the protocol as compared to how many times we should do it based upon our severity. And then we track our mood. Okay.
Okay.
And we attach a number to that. So at the end of each week, there's a tracking of saying, okay, this is what I ate and drank this week. This is how many times I did my 3-step protocol, which we'll talk about it probably in a minute. This is my mood score. So
Right.
I what I usually do with the mood score is I say 10 is the best day of my entire life, 0 is the worst, and we're starting to attach a number to it. So at the end of the week, the maximum score for our mood would be 10, just the best week of our entire life. The worst would be 0. But what we're doing here is we're starting to first introduce mindfulness.
Yeah.
So mindfulness obviously is kind of a new age word, but we're so distracted living in the future and reacting to what ifs, or
Right.
in the past, reacting to the should haves. Okay.
Yeah.
Very few of us are living now. And
Yeah.
so, and then the next step is starting to realize whatever symptom we're experiencing in our life is correlated to our food and
Hmm.
it's correlated with our emotions.
Yeah.
And so I don't go deep into psychology and things like that for this, but what the goal is to have a person start to realize that this isn't a condition that happened to me,
Right.
right? Because we all do this. It's like something comes out of the blue seemingly, which nothing comes out of the blue, but it seems that way, right? And they think, oh my, what happened? What did I do wrong? Poor me, the victim
Right.
idea. But what we're doing here is looking to say, hey, I set up the parameters which allowed certain things to happen and not
Mm.
in a way to feel guilty about, because that's not valuable, but that helps empower to people say, hey, I set up some parameters. This protocol is going to help me set new parameters to get the goal of continence, which is pretty cool. But
Right.
it's also more of a life change because the same process also helps chronic disease. The same
Yeah.
process also helps dysfunctional relationships, right? We're not, fixing those things, but they're all products. We don't
Sure.
like we don't like the products, but we have to look at the ingredients that made the products, and it's going
Yeah.
to be those three. Okay.
Yeah.
So now, based upon the journal, that's a really important part, is we do three different things. The first is a key, it's called a neurofeedback process where we stimulate, and you do that at home. In my office, we do it with acupuncture,
Mm.
but we teach people how to do it at home by stimulating some key, what are called vagal nerve points,
Uh-huh.
and doing specific breathing exercises consistently. And then we have, and I've developed an exercise called the squiggle. So there's no denying that there's a physical component to an
Oh,
incontinence problem.
sure.
So what the squiggle does is some women have scar tissue down in that region, which creates
Mm-hmm.
dysfunction. Some people have neurologic issues. Some people have weakness. So
Yeah.
what the squiggle does is it's an exercise that you would do depending on how severe you are, 3 to 5 to 7 times a day. And what it does, it stretches the perineum, which is the tissue underneath
Right.
your groin and your thigh, as well as starts to retrain the sphincters through a Kegel exercise. Okay.
Wow.
And then the final part of that is a key stimulating acupuncture point on the pubic bone that we
Mm,
do a technique to stimulate that. And what that does is I liken it to a reset button.
yeah.
And I'm sure people can relate to this. You know how when sometimes your computer just doesn't seem to work? It's like it's all funky and does weird stuff,
Hmm.
and you're like, I don't know what's going on. So what do? You just shut it off, right?
Right.
I don't know much about computers, but I'm just going to shut it off and
Yeah.
restart. Well, our body has that similar things. Is when there's neural pathways that have been disrupted, and there's a name for this, it's called neuroplasticity, but the nervous system it changes based upon the environment of which it's subject, right?
Yeah.
So we also used to think that the nervous system doesn't change. A
Yeah.
wire is a wire, like a wire from my, lamp to my outlet. Unless it's broken, everything's cool. Well, that's not actually true. What's true is that wire is constantly in change based upon stress, based
Right.
upon trauma, based upon all of these other life events. So we use a key acupuncture point to help reset that neural pathway. And again, it's about consistency.
Yeah.
Is is when you do it in a consistent process that's measurable and markable, then the body starts to change.
Yeah.
And I would say that's probably the biggest claim to success is I put it together in a simple way, but having the way to follow through a process, track the results, and see the correlation. I found that that's where the real benefit comes into play. It's because it's
Yeah.
kind of a self-discovery. And oh, by the way, guess what's happening is I'm resolving my continence issues. So
Sure.
that's
I
what's
mean,
pretty
I
exciting.
can't even imagine how happy people are going through this and being successful because it's such a big deal. And you're helping not just their physical body, you're kind of making them do other things that are helping clear their mind. And I mean, I'm sure it's just making great changes in a lot of areas. Have you had any success stories that you could share or a success story you could share?
Sure. One of my favorite is Linda. And actually, I think Linda did a video testimonial on my website or online or something. But Linda, lovely woman. I met her. She was in her middle 70s. Um, she came in kind of out of exasperation. And like a lot of people, like her story is she had uterine cancer. So, of course, uterine cancer, she would have had her uterus removed, she would have had the ovaries removed, but then she also had a long period of radiation also.
Yeah.
So not only did she have the scar tissue from surgery, she also had high doses of radiation in the
Yeah.
pelvic region. So radiation, of course, just destroys things, everything in its
Yes.
path, right?
Yeah.
So we had nerve damage, we have soft tissue damage, we had pretty much everything possible. So we started the same way with her. She came in and exasperated, and said, "Hey, I've tried everything." I saw her 6 years after these procedures.
Wow.
So it wasn't like week 2 or 3, kind of
Yeah.
like let's say a stroke patient, right? Is
Yeah.
how quickly they recover is determined upon how quickly they start rehab,
Yeah.
right? So let's
Yeah.
say a stroke patient comes in 6 years after a stroke and says, "Hey, can you help me?" Just statistically, the chances of being helped are pretty slim. So,
Sure.
so I saw her 6 years later, and so I'm like, well, gosh, we'll see what we can do. There's no
Yeah.
loss either way. And so I said, well, let's begin. Usually our program is 30 to 45 days. I said, we're probably going to have to consider 6 months
Yeah.
just because the amount of trauma. So she was using about 8 to 10 diapers a day.
Wow.
And so at an estimated cost of around $500 to $600 a month,
Yes.
just on adult,
Yes.
pad. So, there's a monetary challenge for her because she's
Sure.
like, this is a lot and there's no good option. So we started with her I call it the quid score, and this is a standardized test. It's called the questionnaire for urinary incontinence diagnosis. People can find it online. It's a standardized test by urologists.
Hmm.
She had zero score, meaning or 21, excuse me, means she couldn't hold her bladder under any circumstances, period. And
Yeah.
so we started with her the first couple months, I'd say the first 30 days, she had about a 5% improvement. Now,
Wow.
for most people, like 5%, well, that's pretty lame, right?
Yeah.
Well, for her, 5% means that she could start to actually do a Kegel and
Yeah.
feel the muscles. Like for you and I to be able to sit here and pretend we're going to the bathroom and stopping, it's no big deal. She
Sure.
had no capacity whatsoever. The
Yeah.
nerves were damaged, the soft tissue is damaged. So she had about 5% improvement the first month. Second month, she had about another 10%. Okay. I just saw her in my office last week. She's around 65% improved.
Wow.
Okay. So it's been about 7 or 8 months,
Yeah.
and most people wouldn't need any of that amount of time, but
Sure.
her circumstance is very unusual. But the cool part about it is I'm going to expect the fact that she has around 65% improvement, she's probably going to get more. Just
Yeah.
the fact that she has the capacity to control things, the neurologic function, which is the vagal nerve stimulation and the neurofeedback
Right.
components, they're continuing to evolve. So I would say she shocked me, and I'm really excited for her because she still uses pads, but she's using 1 to 2 a day.
That's
That's
amazing.
that's a big difference. And then just from a fiscal standpoint, is she's saving herself $300 to $400 a month. Um,
Yeah.
and for a 70-some-year-old person who's not independently wealthy, that's a big deal,
That
right?
is a very big deal because it is expensive. And for, you know, besides the embarrassment, besides the, limitations that it puts on you not being able to go and do, it is expensive. So that's incredible. I love that.
Yeah.
So,
So she inspired me. So it was pretty
yeah.
awesome. Yeah.
Yeah. So for any woman listening who maybe is embarrassed, who has this problem, besides going and getting your information, your protocol, and all your things, what is something you could say to offer some hope?
Sure. So I'd say the number one hope is, and this is going to sound a little esoteric. Culturally, we've been led to believe that the body is inherently flawed. I want to challenge that thinking.
Mhm.
The body is inherently almost perfect. It's us that flaws it.
Right.
It's what we put in. It's our thinking, it's our habits, it's our function.
Yeah.
So that statement alone for me is incredibly inspiring. Now, some people it feels overwhelming and scary, but that means what we really need to do is remove barriers.
Yeah.
We created the barriers unconsciously, of course, but I'm here to kind of start to bring some of these things to light is if
Yeah.
we start removing some of those barriers. Now, the very first barrier is I always start with food. And so people
Mhm.
say, well, what can I do right now? I'll say, buy a notebook. I don't like phones that much, but some people love apps. An app, start writing down everything you eat and drink and
Yeah.
start being mindful of how you feel. That can
Mm.
be physically if you want, like a symptom, or I would say emotionally of happy, sad, or you pick whatever your emotion is,
Yeah.
and just start becoming conscientious
Hmm.
because the protocol works, which is awesome, but being mindful is the first step to changing anything.
Sure.
And so I use this silly analogy in a lot of our discussions I have with people and patients and whatnot is, well, people say, well, that seems kind of silly. Why do I have to pay attention to my food? Well, imagine you were counseling me over finances. And I said, Shara, I'm broke. I don't have a nickel to my name. Help me out. And you'd say, well, what are you spending your money on? And I'd say, well, gosh, I don't know. And you'd simply tell me, well, let's start paying attention. Write
Right.
it down. Every
Yeah.
dollar you spend, write it down. And at the end of the week, let's catch up and we'll start talking. And I write everything down for the whole week. And you look at my piece of paper and you say, hey, Nigel, you're spending $9 on a cup of coffee. Why don't we start changing that one first?
Right.
So
Yeah.
you just opened my whole mind of
Yeah.
I didn't have any money, I didn't know what to do. Give me more money, it'll solve my problem. Well, more money is not going to solve a bad spending problem,
Right.
right? It's just going to make me spend more.
Right.
And that's the way it is with health. Is
Yeah.
health is most people are like, "Hey, doctor, I'm broke, fixed me." My job is to say, there's a problem that you're unaware of. Let's look into the
Yeah.
ingredients that created that and those variables, and let's start making some variable changes over time.
Sure.
And I get it. I'm like everyone else. I would love a magic fix, but if we start taking small changes, they morph
Hmm.
into bigger changes because all of our life experiences are just a product of
Right.
all these changes that have built up over time. Does that
Yeah.
make sense?
That makes perfect sense. I think it's so important. I am thankful that I've always been pretty healthy, but in the last few years, as I have started going through perimenopause, I have paid so much more attention to everything, what I'm eating, what I'm drinking, what I'm doing what I'm thinking. Like I've never in my life paid more attention to my body than I have the last few years because I'm going through so many changes. And I think this is so important. I'm very excited to share this interview because I think lots of people are going to, I mean, my audience is primarily women, so lots of people are going to appreciate this. Is there anything that I have not asked you that you want to tell me about?
Um, yeah, not so much asking, but I guess kind of I'll say my pulpit, for
Sure.
lack of a better word, is I just hope that people can start making a little bit of a mental shift,
Mm-hmm.
because I'll go back to culturally. Is culturally we've been conditioned to think that doctors hold the answers. Give me the pill, the
Right.
solution, the process, whatever. I'm fixed, move along. I'm going to encourage them to start thinking about health differently, because health isn't I feel good right now, I must be fixed.
Yeah.
How we all feel is a preference, right? I prefer to feel great all the time, and I do most of the time, okay? But our body gives us signs long before problems arise.
Right.
And that's where that mindfulness part comes into play. It's like, how do I feel at the end of the day? Do I come home and I'm all agitated and irritated? Well, that influences our physiology. Okay. Do people inherently piss me off all the time? Right.
Right. Yeah.
So to be so blunt, is that's a an individual mental challenge that is
Yeah.
affecting your biology.
Sure.
Long-term anxiety or anger, that's affecting your physiology.
Yeah.
So people think, oh, how I feel about the world is not affecting my body. Wrong. It's absolutely affecting your body.
Right.
And solution isn't in a pill, even though pills have value for the short term, they're not the solution. So
Yeah.
I guess what I'm encouraging people to do from a bigger point of view is start being a little more introspective, because
Mm-hmm.
we've been kind of conditioned to point to everyone else as our problem, and the world is a problem, or the government's a problem, or the weather's the problem, or we all do it to some
Right.
degree. But I'm going to encourage people to start kind of looking at themselves first, because
Mm-hmm.
that's where the solutions lie. And people
Sure.
like me, my job isn't to fix people. My job is to give them tools and protocols that work, and give them
Yeah.
guidance as they start making mental and physical changes that get them where
Yeah.
they want to go. So I
Well,
would
I
say that
love
would be the
this.
big.
Yeah. I appreciate you sharing all of this. I think it's so important. And I'm very excited to share this. And this one, I love the people I get to talk to, but sometimes there are some that are so important that I just get really excited about. And I think this is one it's going to affect a lot of people. So I appreciate you.
Yeah, thanks, Cher. I appreciate you, and I love this opportunity to talk and share and get to know you better too. So it's nice. Thank you. Thank
Absolutely.
you so much. Have a
Thank
great
you.
day.
Enjoy your day.
All right, bye-bye.
Okay. Bye bye.